Hello, in this video I'm going to be talking about survival rates with different breast cancer stages and types. Before I go on, I'd love to have you subscribe to our channel because we give much more detailed information about all the things I'll be talking about in this video. And if you subscribe, you'll get to see new content all the time. Don't forget also to go to Yerbba.com to get your personalized report and the different treatment options that may be offered to you. So I'm going to go stage by stage and talk about survival rates. And first I'll explain what stage is, then I'll give you some cautions with any of these statistics, and then I'll go through each stage, providing you the most precise information that I can. If you don't want to know, you might want to stop this video here. Some people find this information really helpful, and some people find it really depressing. Only you can know if this is useful. One thing I do know is that medical teams often don't give this information unless people ask specifically because they don't think you want to know, when really maybe you just don't know how to ask the question. So let's go stage by stage. Stage refers to where the cancer is in the body, how much disease there is. And I'll start with stage 0, breast cancer, also known as ductal carcinoma in situ, or DCIS. DCIS, and we have another video about DCIS, means that the cancer hasn't spread out of the ductules within the breast itself. So it's non-invasive. It's staying right within the ducts or the tubular structures of the breast. It hasn't gone through the basement membrane. It can't invade, so it can't, by definition, spread to other parts of the body. It can't lead to the death of somebody, by definition. That doesn't mean the cancer can't come back in the breast or that one can't get another cancer in the other breast. But if somebody truly has ductal carcinoma in situ, their survival rate will be 100% because it can't spread. Stage 1 disease means that there's disease only in the breast and that it's pretty minimal disease. So no positive lymph nodes, and the tumor is less than 2 centimeters. So it's less than an inch, well under an inch. Stage 2 disease, breast cancer, means that the tumor is either over 2 centimeters and less than 5 centimeters, or there's a positive lymph node up to 3 positive lymph nodes, or both. So somebody can have stage 2 disease if they have a tiny tumor, but 3 positive lymph nodes, or they can have a tumor that's, let's say, 3 centimeters with negative nodes, or up to 1 to 3 positive nodes. Stage 3 disease means that the tumor is either over 5 centimeters, or there are 4 to 9 positive lymph nodes, or both. So you can have a stage 3 tumor if the tumor is 6 centimeters, or if you have 4 to 9 positive lymph nodes, or both. You can also have a tiny tumor and 4 to 9 positive lymph nodes and have that be stage 3 disease. Stage 3 disease also refers to tumors that have invaded the skin or the chest wall, regardless of the number of lymph nodes. And stage 4 disease means that the cancer has spread to other parts of the body outside the breast and the lymph nodes. And that can be either at the time you're diagnosed or later on, though technically it refers to the time you're diagnosed. And if cancer comes back later, that's metastatic or advanced breast cancer. I know that's a lot to cover, and we've got a lot more information stage by stage, but in case this is the first video of ours you're watching, I just wanted you to know a rough idea of the stage. There are a couple other types of things it's worth talking about. One is inflammatory breast cancer. We have a whole video on inflammatory breast cancer. Inflammatory breast cancer refers to what the breast looks like, and somebody could have stage 3 inflammatory breast cancer or stage 4. Because cancers involving the skin, it's really rare to have less than stage 3 inflammatory breast cancer. And actually, we don't usually talk about stages with inflammatory breast cancer because we treat this type of breast cancer really aggressively. Now, I've gone through all these different stages, and I'm sure you're waiting for me to tell you the recurrence rate or the likelihood that you'll survive based on each stage. But there's so many other things that go into it. So we look at the personality or the biology of the tumor as well as the stage. What I mean by that is we look at the hormone receptor status, estrogen and progesterone receptor status. We look at the HER2 status, that stands for human epidermal growth factor receptor, and we have a whole video on that. We look at the grade of the tumor. That's how active the cells look under the microscope. In some people, we get a genomic assay, and that can be very helpful in knowing what the survival rate will be. So these biology features, these tumor personality features, play a tremendous role in the risk of recurrence and the chance of surviving breast cancer. Another thing I want to share is that our statistics are automatically outdated. So if you ask me what's the 10-year survival rate, I have to look at people diagnosed 10 years ago. And we have new treatments since then. So it's really hard for us to say with everything I have available today, new treatments that we've discovered in the past couple years that are helpful, somebody treated 10 years ago didn't have those treatments. So if I'm looking at the 10-year survival rates, they're already kind of outdated. I'm hoping that makes sense. If it doesn't, put a comment or question below. But by definition, 20 years is even harder, right? Because all the people treated 20 years ago didn't have access to things that we use routinely now that are used, with great confidence in improving survival rates. So that's important to keep in mind. The other thing is we don't really have data on people who declined all therapy. So we don't know if, let's say you're watching this video wondering, should I get chemotherapy? Should I just disappear and never go back to this team? Never go back and get treated for breast cancer? Those folks that have decided not to get treatment are also not seen in follow-up, and our survival statistics come from people being seen by their medical team and filling out forms for registries saying how that person is doing. So we don't know long-term survival in people who just disappear and decline all forms of therapy. The types of statistics we have from people who don't get a certain treatment come from randomized clinical trials where we look at people who get endocrine therapy compared to people who don't, people who get chemotherapy compared to people who don't, and all those people are followed closely, and they got other forms of treatment. So the studies looking at endocrine therapy and does it improve survival are done in people who have had surgery, who have had radiation therapy, many of whom have had chemotherapy, and then get endocrine therapy or not, or a particular type of endocrine therapy versus the standard. So if you're watching this to know what will happen if I do nothing, it's going to be really hard for us to tell you the long-term survival if you just get no treatment at all. So with all those caveats in mind, I'm going to go through stage by stage and give you a range, and that will help you see what your survival would mean with different types of tumor personality. And when we talk about 5-year survival, we're talking about a couple different things. There's one called disease-free survival, where the cancer hasn't come back and you've gone on to, yes, recover from all the treatment and yes, have changes in your relationships, but there's no evidence that the cancer's coming back. And then some of our survival statistics include people who are alive, whether or not the disease has come back. So that's called overall survival. And then there's disease-free survival, where you haven't seen the cancer in your body. There's no signs that it's come back. What I'm going to be giving you is a blend between overall and disease-free survival, because for some cancers, the number of people who relapse is so low that it's hard for us to make a distinction between overall survival and disease-free survival. Okay, all those caveats aside, let's talk about stage 1 breast cancer. The survival rate for stage 1 breast cancer is between 90 and 100%, depending on the type of tumor it is. So stage 1 cancer, remember, is not a lot of disease, but if the tumor is estrogen receptor negative and HER2 positive, people are going to be closer to that 90% mark than they are to the 100% mark. Though with current treatments, again, remember what I said about data being outdated, even in hormone receptor negative, triple negative, HER2 positive breast cancer, their survival is getting better and better because of the treatments we have, because the things we're offering now that we weren't offering 5 years ago. So as you can tell, regardless of the tumor type, the vast majority of people are alive at 5 years and even 10 years. And that's, to be honest, I'm kind of greedy. I don't think 5 years is enough. So the 10-year survival rate's going to be, 90% or higher in people with stage 1 breast cancer, and maybe even higher than that if the tumor did not have any negative biologic features. Next, I'm going to talk about stage 2 disease. And stage 2 disease is divided into stage 2A and 2B. I'm not going to go into the details, but if somebody has 3 positive nodes and a larger tumor, that's going to be a higher risk tumor than somebody who has a small tumor with 1 positive node, or a little bit bigger, a tumor with negative nodes. So in stage 2A disease, the 5-year disease-free and overall survival rate is going to be 80 to 90%, depending on the tumor features. The 10-year survival rates will be a little bit lower, so probably closer to 80%, with no evidence of disease at 10 years. Stage 2B disease, the survival statistics are more like 70 to 85%. So this is a bigger tumor with positive, 3 positive nodes. And again, it depends on the tumor biology. So the vast majority of people will be alive and thriving at 5 and more years. So 3/4 of people will be doing well. Let's talk about stage 3 cancer. This is A, B, and C, stage 3 cancer. Generally, what we cite for people is, depending on the tumor biology, between 50 and 70% of people will be alive and disease-free at 5 and even 10 years. So even with stage 3 disease, it's really important to know that there are just as many people alive with treatment as there are people who have had a recurrence of their breast cancer and perhaps died. So yes, the statistics are not as good, but it's still more likely than not that people with stage 3 disease will have no disease or be living just fine, again, with the side effects of treatment and all the changes that happen to your body and to your social life and the way people treat you, but without cancer at 5 and even 10 years. Stage 4 disease is really interesting. It's kind of in 2 groups. So if you look this up on Google, what you'll find is that we say the 5-year survival rate for people with stage 4 disease is 2 years. But it's really uncommon to see people living that short a time. It's much more common to see people living longer. Again, those 5-year statistics are out of date, and we've had so many advances in advanced breast cancer that our statistics are out of date, and we can use one treatment after another as long as people feel good and feel that treatment outweighs, the benefits of treatment outweigh the side effects. In people with advanced disease, we see people living 20 years with feeling really good, and sometimes they're not even still on treatment. I do want to make special note of inflammatory breast cancer. We know a lot about inflammatory breast cancer. Inflammatory breast cancer is more active or more likely to come back than other types of breast cancer. In people with stages 2B, or as I mentioned, more likely stage 3 breast cancer, the likelihood of being disease-free at 5 years is 50%. So it's not as good as it is with non-inflammatory breast cancer. And with distant disease, it's much more difficult to treat than non-inflammatory breast cancer. But again, it depends on the HER2 status and the hormone receptor status. This is a type of breast cancer none of us likes, and if you're living with it now, we are here for you. There are support communities for people with inflammatory breast cancer, but it's important to hear that 50% of people are free of disease at 5 years. As much as we talk about 50% of people have a recurrence, it's also important to know that 50% of people don't have a recurrence, and we're always making advances. So I know this is hard to hear. If this information is not useful for you and makes you feel down, it's hard to live with uncertainty. It's hard to live hearing you have a chronic disease. And, even if you had stage 1 breast cancer, If you're on an aromatase inhibitor and you feel miserable, these statistics may actually not be that encouraging. So I just want to validate that however you feel is how you feel, and it's okay. Those are real feelings, and you have every right to your feelings. Don't let people tell you to cheer up. Don't let me tell you to cheer up. None of us here is going to tell you how to feel. We just believe at Yerbba that knowledge is power, and if you have high quality information, you can make decisions based on your values, what's important to you, with a full set of information. Again, everybody's story is different, so these are just broad generalities. I hope this has been helpful. Drop a comment or question below. While we can't tell you your prognosis because we're not part of your medical team, we certainly can clarify anything we said that's not clear or talk about specifics to a particular subtype of breast cancer you have. Thank you so much for watching and being part of the Yerbba community.